Hi, it's Dr. Ben from The Developing Doctor. This video is part of a series of videos evaluating the steps pre-med students can take to optimize their chances of being accepted to medical school. The focus of this video is on one of the most common questions pre-med students ask me, which is, do I need to participate in research to be accepted to medical school? So if you're a pre-med student who's considering participating in research and you asked yourself the same question, keep watching the video to find out the answer. So, is research necessary to be accepted to medical school? The short answer is no. The more important question is, will research help you get into medical school? Research experience never hurts and can only help an application, but it's not necessary to gain acceptance to medical school. When deciding if research is right for you, it's important to remember that your application will be compared to others during the application process. On review of the last several application cycles, about 60% of applicants participate in research. It's also important to note that medical school applicants may have limited time. If you find yourself in a position of having to choose between research, clinical activities, service activities, or a leadership position in a student organization, medical school admissions committees report that research may not be weighted as heavily as clinical or service-related activities during the admissions process. Regardless of the effect it has on your chances of being admitted, it's also important to ask yourself why medical schools value research experience in their applicants and medical students. Participating in research teaches critical thinking skills that are necessary for the practice of medicine. Every practicing physician encounters a question they don't know the answer to. The scientific process learned through research of generating hypotheses, designing a study, analyzing data, and drawing conclusions are skills that are directly transferable to the clinical setting. It's commonly assumed that pre-med students must participate in basic biomedical research. In reality, all types of research teach the same set of skills. Let's look at the different types of research opportunities available. Basic science or benchtop research is what people commonly picture when they think of research. It involves running gels, pipetting, and using microscopes. It's typically performed in a laboratory in a team setting. Clinical research is the study of the safety and effectiveness of the most promising advances in patient care. It's different than laboratory research in that it involves people who volunteer to participate. Observational studies review data to look for patterns, and clinical trials look at interventions like new drugs or procedures. Health policy research evaluates how laws and policies impact the health of the population. Examples of some types of health policy research would be to look at how insurance access impacts survival rates and access to care. Research in medical education evaluates teaching methods in medical education. A project evaluating the value of simulation training for students on surgical rotations is an example of one such project. Biomedical engineering research applies engineering and design principles to medicine. It involves the development of new medical devices and diagnostic tools. Finally, narrative medicine involves gathering and using stories to understand the patient and provider experiences better. It's very different than, but just as valuable as the other types of research. After hearing that information, if you're still interested in research, let's talk about what you should get out of the research experience. Participating in research shows a dedication to advancing knowledge. Hopefully, you leave your research experience with an appreciation of the scientific process and a sense of curiosity. Research also requires and teaches teamwork. A common question on secondary applications is to describe a time when you worked on a team. Participating in research provides an answer to that question. It's very common for research experiments to fail. Participating in research demonstrates that you have experienced and can deal with failure. In addition, you'll gain valuable writing skills and may have the opportunity to publish your research. Finally, you may discover that you enjoy research and decide to pursue research as part of your medical career. If you're asking yourself how to find the right research opportunity, here are a couple tips you can use on your campus. After all that information, is research right for you? Only you can answer that question. There are plenty of reasons to participate in research. It teaches critical thinking skills, scientific writing skills, and allows you the opportunity to contribute to the scientific literature. Never participate in research just because you think it will increase your chances of admission to medical school. If that's your reason, find an activity that you enjoy and choose that instead. Thanks for watching the video. I hope you found it helpful. If you did, please give me a like, subscribe to the channel, and consider booking a free coaching session with me. I've got over 20 years working in academic medicine and helped countless students like you achieve their dreams of becoming a doctor. I'd love to help you do the same.